Welcome back to Living Local. Major depression is one of the most common mental health conditions in our country, affecting more than 16 million American adults every year. For some, talking to a professional can help. For others, medication can manage symptoms. But what happens when people aren't getting better with therapy and antidepressants? One local mental health center is offering an alternative treatment option. Joining us via Zoom today is Dr. Richard K. Whitaker. He's the CEO of Vera French. Dr. Whitaker, thank you so much for joining us again.
You're welcome. Thank you.
So first of all, what is major depression?
Well, you know, Brittany, we're all familiar with depression, right? It's when you're not feeling well, you're not feeling happy, you're struggling with even enjoying some of the most basic things. But major depression is when depression lasts a long time, where for months you're just struggling with a depressed mood, disturbed sleep, you're not feeling good, you feel guilty or inadequate almost all the time, maybe even have suicidal thoughts. And most people get relief from antidepressant medications. In fact, here at Vera French, we have 3 psychiatrists and 8 nurse practitioners who help people with major depression all the time, and they can prescribe medications. And in fact, we help thousands of people every year with major depression through the use of effective antidepressant medications and talk therapy.
Yeah, those resources are incredible and can be very effective for most folks. You know, Dr. Whitaker, when I was researching this, I was just honestly shocked that 16 million American adults, and that's not even talking about adolescents, do struggle with major depression. So it's so important that we have these resources available for folks. And in addition to the medicine as well as the talk therapy, Vera French is actually offering a new treatment for folks with major depression. Can you tell us more about that?
Yeah, well, while most people get help from medications, about 20% of those with major depression don't get better with antidepressant medication and talk therapy. For these folks, Vera French is bringing an exciting alternative called transcranial magnetic stimulation, or TMS. And it's been FDA approved since 2008. And TMS uses the same magnetic technology used in an MRI, but it focuses that magnetic pulse is focused and targeted to those parts of the brain that control mood. Previously, people had to travel hours to get TMS treatments, and Vera French waited until we knew it was safe and effective before bringing it to the Quad Cities. And you know, the research now shows that most of those with major depression who try Neurostar TMS, which is what we're doing here at Vera French, most of those folks will experience significant improvement in their symptoms.
Wow, so what a blessing that this is here in the Quad Cities. Now, you described TMS delivers those magnetic pulses to the parts of the brain that control mood. So how does TMS actually work and how effective is it?
So the way I talk about TMS, in that delivering that magnetic pulse to the part of the brain that controls mood is kind of like waking up that part of the brain. And you know, TMS isn't just done once. It needs to occur every day over 6 weeks. So 5 days a week for about 20 minutes each day. And each time that magnetic pulse is waking up that part of the brain. And if we do that long enough, research shows that the brain starts doing what it needs to do on its own. And it starts to wake up itself. The neurotransmitters start to fire, synapses, everything starts to happen the way it should. And we get better as a result of that consistent TMS treatment until finally people are doing so much better and not needing that treatment anymore.
Wow, it sounds like such an encouraging treatment with all of the evidence of its effectiveness. Now, if a person comes to Vera French for a Neurostar TMS treatment session, what can they expect from start to finish?
Well, first of all, people wanting to check out Neurostar TMS will have to have a consultation appointment with one of our psychiatrists to determine if TMS is right for them. Then they'll come back for a mapping session when the psychiatrist will identify the exact right location where that magnetic pulse needs to be delivered to make a difference. Then treatment is delivered for 20 minutes each day. You sit in a nice, comfortable chair, this magnet that looks about like my cupped hand is placed on your head, just lightly touching your head, and then you get that magnetic pulse for about 20 minutes. Now, it doesn't happen for the full 20 minutes. They do some pulses and they pause, then they do some more pulses and pause. I've actually felt it, and it feels a lot like tapping inside your brain, or just inside your skull, actually, a little bit of a tapping sensation. So you know something's happening. But you know, after 2 or 3 weeks of treatments, people start to feel better from their depression. And family members even will tell us that, hey, I noticed that they're just seeming more alive, that they're kind of waking up, they don't have that fog anymore. And what we notice from our experience is that we see patients getting better as well. We see them talking about things they enjoy, starting to do things that they used to do, that you know, like getting back into woodworking or crafts, or you know, they even start to want to go back to work, or work becomes more enjoyable for them.
Wow. Dr. Whitaker, we know that most medications do have side effects. What about TMS?
You know, Brittany, that's the most exciting thing about TMS. Most medications do have those side effects, and they really bother people, like weight gain or dry mouth, and they make it hard for people to want to keep taking that medication. But not TMS. Neurostar TMS doesn't have any of these side effects. The only side effect really is maybe some discomfort. Like I said, it feels like a tapping on your head. It might give you a little bit of a headache that goes away shortly after treatment, and some people, after a few treatments, don't even notice it. But that's really the only side effect. When you're done with TMS, you walk out of the office and go drive home and go on with your day.
Sounds like a win-win. Now, this all sounds very high-tech, of course, involving magnetic pulses and equipment. It may make some folks out there maybe a little nervous. So who exactly delivers the TMS treatment, and how do you reassure people during the process?
Well, our Neurostar is located right at our main office on Central Park Avenue in Davenport. And we make sure that the psychiatrist that does that initial mapping is there monitoring what happens at all times. And you'll have somebody with you. Nicole or Candace is going to be with you there in the treatment room. It's all very comfortable, everything made to be almost spa-like, so that you get this really sort of break out of your day. And we have a TV that you can watch your program on, or you can listen to music on earbuds. And you know, we also make sure that the office is a safe place to come. During the pandemic, we want to make sure that we screen at the front door. We have air purifiers running. Everybody wears a mask. It's a safe place to come during the pandemic too. So everything's made for your comfort and to help you to have the best experience that you can have during those 6 weeks of treatment.
Now, I know a lot of folks out there may be wondering, is Neurostar TMS covered by insurance, and how would they go about getting started with treatment?
Well, Brittany, we're also super excited that Neurostar is covered by insurance here at Vera French. Most major insurances, including Medicaid, Medicare, TRICARE for our veterans, United Health, Optum, Wellmark, Aetna, Cigna, Humana, all of those cover Neurostar. And to get started with Neurostar TMS, all it takes is a phone call to Vera French, and let our receptionist know that you want to talk to someone about starting Neurostar TMS. It's that easy.
Dr. Whitaker, thank you so much for joining us today and for being so proactive about bringing this new treatment plan to Quad citizens. We so appreciate it.
Oh, you bet. Thank you. You're welcome.
If you would like some more information, you can visit verafrenchmhc.org. We'll also have those details posted on ourquadcities.com.